The FDA expected to authorize new COVID booster shots this week without data from human clinical trials. Those trials have not yet been completed, and the agency plans to assess the shots using data from other sources, including research in mice and performance of earlier iterations of the booster. Join us now, Dr. Scott Gottlieb, former FDA commissioner and a CNBC contributor. He also serves on the boards of Illumina and Pfizer. Doctor, this is kind of fulfills the promise of the technology to some extent, that it's like a software upgrade, and we probably can be fairly confident that it would not be that different in terms of how it works or what the side effect profile. Is that what is allowing us to do this without additional trials?
Yeah, look, I think you're seeing the FDA change its orientation towards the approval of these vaccines, more towards how they view flu vaccines, that they can make extrapolations from the immunogenicity data, the data on the ability of the vaccine to generate an antibody response, and impute from that what the clinical benefit of the vaccine is going to be. Remember, we don't only have data from the ancestral strain. We have, obviously, hundreds of millions of patient data from the ancestral strain vaccine. Many people receive boosters of that. We also have data from clinical trials involving the vaccine that was developed against B1. We have clinical data from the trials of the vaccine that was developed against Delta, the vaccine that was generated against B117, the vaccine that was generated against the original South African strain. So there's now been multiple vaccines that have been developed, that have been put into clinical development, clinical trials. And FDA is looking across all that data, and they're seeing consistency in terms of their ability to not just see a safety profile that's consistent across those different vaccines, but also be able to impute a clinical benefit based on the immunogenicity data, the antibody response from the vaccine. I think that's what's informing their ability to now move towards this new paradigm that really reflects how they treat flu vaccines.
So we got a little bit of diversity in in COVID and the different variants, but anything on the horizon really troubling to you at this point, Doctor?
Not right now. There's this strain that you're seeing in some European nations that seems to be a hybrid between Delta and the original B1 Omicron strain that has some people concerned. We're not seeing anything spread with significant velocity, and I think that that's a reflection of the fact that a lot of the new variants that are emerging, and we're always going to find new variants emerging and pockets of outbreaks with new variants, but the reason why I think none of them so far have gained a foothold is that we have very broad and deep immunity in the population, and most people have seen some variation of the variants that have emerged, and so there's a lot of immunity to those. Right now in the United States, we're seeing an epidemic of B5 and B4 that's declining overall because the hotspots, the West Coast, the Southwest, Florida, are all coming down, and the places where the epidemic's now shifting to are smaller states like Alabama, Louisiana, Kentucky, West Virginia, Tennessee, Oklahoma. That's where you're seeing the rapid case growth. Overall, cases are coming down nationally. I still think we're not out of the woods on B5 and B4. The tri-state region really hasn't had much of a B5 epidemic, and while cases are coming down right now, 20% reduction over the last 14 days in New York, New Jersey, and Connecticut, and a declining positivity rate as well, we're probably going to see a pickup. I think the hope is that the new vaccine comes out in time to be a backstop against that. I think that is possible. If you see an authorization this week and CDC makes a recommendation for that vaccine to be made available, that we can get people vaccinated in the month of September ahead of what could be a B5 surge here in the Northeast.
Shepard Smith here. Thanks for watching CNBC on YouTube.